the role of regulation, when done right, is to protect users, is to sort of build accountability among corporations, to have rights based approaches to protect users.
Hi, I'm Joanne,
Hi, I'm Shashank.
and welcome to the CCG Tech Podcast.
Hi, Amrita. Welcome to the CCG Tech Podcast. Thanks for joining us today. I think let's begin with you giving us a short introduction of yourself and tell us a little bit about the work that you do. And then maybe you can very briefly take us through the inquiry in trying to understand the use of AI in the healthcare sector in India and just give us an idea of what the motivations were behind this.
Great. Thanks so much, Joanne, and thanks for having me on the podcast. I'm Amrita. I'm currently a CyberBRICS fellow looking at questions of AI governance and sovereignty, and also looking at the interactions of AI and digital public infrastructure. This is at the Center for Technology and Society, FGV Rio. Until recently, I was the research and program lead at the Center for Internet and Society. I'm a sociologist by training, and at CIS, my research interests were in the areas of AI, trust and online harms, looking at questions of platform accountability, information disorders. There are two projects at CIS that maybe I can talk about briefly. We worked on two sort of flagship mixed methods reports. One was, of course, the AI and healthcare project that we will talk a little bit more about today. And the second was a report on the digitalization of finance in India with a specific focus on questions of access, benefits, and looking at online frauds. Yeah, prior to this, I've worked at other organizations looking at large scale people practices, diversity and inclusion in the workplace, as well as conducting and leading long form research. I'm also on the board of the Green Web Foundation, which investigates the environmental impacts of technology. Talking a little bit about the AI and healthcare project, this is a project that we started about 2 years ago. We wanted to, at that point, there was already some sort of interest in questions of using AI for healthcare. But we did not think that there was enough investigation on what are sort of the governance mechanisms that are being used, what are the regulatory approaches, and in the absence of significant regulatory approaches, are there alternative self-governance mechanisms that are in place or that could be investigated. So that was really the motivation of our study. So we kind of started off with this question of, for understanding more from an exploratory point of view, what really are the AI use cases? What is the current use of AI in healthcare as it stands in India today, both in public and private healthcare? And then trying to understand, the data supply chain. We know that data is one of the key aspects of using or developing AI systems. So we really wanted to understand where is the data coming from, how is that being processed, how is that being used to then train AI models. So that was really the motivation of our study, and I can perhaps talk a little bit more about how we went about it and others after this.
Great, thanks for that, Amrita. It's very interesting to hear, and something that you're pointing to already. Could you maybe discuss with us a bit on, what are the use cases that came up as part of your investigation, and what are the use cases in India where AI is being used in healthcare, and some prominent ones as well?
Sure, thanks, Shashank. I think also just to point that, of course, this research is now slightly old, so I would imagine that there could be more use cases that are coming up more recently. We've been in a few recent conversations where there is more uptake in public health as well in certain areas of chatbots and so on. But I'll try to give a sort of overview of what we found. And we used almost sort of like a purpose based classification to see what is really popular or what is being looked into or researched. So, one of them, of course, is the image based diagnosis, which is essentially processing images and scans to diagnose diseases. Essentially being used in radiology quite a bit. There is also, the primary health consultations where these sort of chatbots and messaging platforms are facilitating doctor patient communication. A lot of the AI used right now is also in administration and management, essentially to improve internal efficiencies and operational efficiencies at organizations. So, predicting maintenance requirements and improving decision making in non clinical areas, and This is something that we've also seen in slightly larger private hospitals that's been coming up. For example, Microsoft's AI services automate operational and administrative tasks, such as documenting electronic medical records and so on. Apart from that, there's one area that we actually didn't explore, which was slightly, which is slightly actually advanced when it comes to research, which is around drug discovery to think about like predicting potential chemical compounds and enabling drug repurposing. There's a lot of research work that's happening around this, but this was out of scope for our study. And others are, use cases in epidemiology, facilitating disease surveillance. We saw that this was something that was majorly used also during the COVID-19 pandemic, where there was some disease surveillance that was happening through the use of AI. Art Park has done some work around this on for dengue surveillance in Bangalore. Vadvani AI's event-based disease outbreak monitoring system actually scans digital media to track events that can signal a disease outbreak. So these are some sort of the use cases that were emergent when we were working on this.
Thanks, Amrita. Thanks for the insight into the use cases as well. You mentioned early on that part of the motivations of looking at the study was also to understand alternative governance mechanisms. So I'm curious to hear about what prompted the study to focus on auditing as a governance mechanism for AI systems in the Indian healthcare sector. Has the landscape at all contributed to this, to you looking at alternate governance mechanisms as well?
So I think auditing at the time that we were, this was a sort of grant that we received, and at the time, algorithmic auditing was something that was being explored more so in the global north as a response to, investigating AI systems. We know that we've had sort of a journey where we've talked about ethics in AI. There have been conversations around fairness, accountability, transparency in AI systems, whether AI systems can be explainable and to what extent AI systems can be explainable and interpretable. And those conversations have gone in various directions where, of course, some actors have tried to make their models more explainable, or even like open source AI models, which allow you to have slightly more, open source models that actually allow you to investigate how those models have been trained, on what kind of weights have been applied and so on. So what we wanted to understand was, given that there isn't a definitive answer on we have solved for the problem of ethics, for the problem of transparency in AI systems, we wanted to look at what is the existing literature, and can it serve a purpose in the Indian context. Also, because we know that AI now in healthcare is being used across public and private sector, and given the sort of safety critical nature of healthcare in itself, given that there are very severe consequences that may happen in the case of wrong decision making, we thought that it's a good point for us to investigate if this is something that we can suggest even for hospitals and private actors to look into, to make their systems more auditable, to create greater accountability within the system. So within audits, of course, at this point, the conversation has been fairly nascent. There hasn't really been a lot of work that has happened either in India, even globally. A lot of the work that's happening around audits is sort of at the scale of at this point of research. So we thought this is a good point to at least see if organizations are even doing any of the activities that are revolving around audits, and I can talk a little bit more about like what that could look like, just to get a sense of if this is something that may be possible in the Indian context.
Right. I think that's useful. And I think we'll also get into what it means for auditing in the context of the study's findings over the course of the conversation. But given that audits of AI systems can take different approaches or can look different based off of the types of purposes that it's trying to achieve through the auditing process. And this, from my understanding, could you maybe give us an idea of what an AI audit would involve, or maybe some approaches or frameworks that would guide audits more generally?
Sure, yeah. So, I mean, auditing typically has existed if we think about the financial services sector, or most organizations go through internal audits, and the purpose of these audits is to create accountability and create greater corporate accountability, so and transparency and good governance, and by that process, so the AI audits actually, given that it's fairly nascent, the idea of AI audits is to be able to evaluate AI systems. Now, to what extent those evaluations may happen and what is the extent of access that the auditor may have to the data supply chain are all really dependent on what ways in which the audits are being conducted. So, we looked at two questions essentially: who conducts these audits? So, whether it is internal or external, and what are certain components that the audits can include, right? So, to talk about first maybe the internal versus external question, so the internal audits would typically mean that somebody within the organization who has the skills and expertise to conduct audits could do this practice of conducting the audit. Of course, it requires slightly differentiated skills from a person who does other financial audits, but there may be some ways in which the internal audit people who do internal audits may have greater access to certain data sets, certain so the training data sets, even more insights into the models, which an external auditor may not have. Essentially, the point is that within internal audits, you may need a lot more information. Some of that information may actually be trade secrets, right? Like fairly confidential information. So what the internal audit allows you to do is at least have access to those to do a robust check on your algorithms. For external audits, of course, it's a third party auditor. It could be somebody from an external party who does the audits. This would mean that there might be certain limitations with respect to the extent of information that may be made available to the auditor. But of course, what it also does is creates greater sort of accountability, because there is perceivably greater independence of this third party auditor that may conduct this evaluation. In terms of frameworks, I think what we found from the literature is that there is really no one size fits all approach to AI auditing. There are certain frameworks that we looked at, and I can perhaps talk about two or three of them which were specifically for healthcare. One of them was this framework called algorithmic vigilance, which combines automated statistical tests to monitor the performance of AI systems with an assessment of human factors, such as what is the impact of medical decision making, and transparent reporting of algorithmic vulnerabilities. There are also various ethical AI frameworks which use the AI lifecycle approach to assess the system's performance. They look at certain, ethical principles. Particularly in healthcare, there are principles of bioethics, which are, include things like autonomy, beneficence, non-maleficence, justice, and so on. There were certain more specific frameworks that we looked at, like the medical algorithmic audit framework, that is particularly helpful when the goal is to also preempt errors and biases during the development process and not post facto, essentially to say that the audits are happening across the data life cycle, the process of model training, and not at the end of when the model has been deployed. So this essentially combines two approaches of, I don't want to get into the details, it may be a little bit more technical, but it's called the SMACTO framework and the FMEA framework, which essentially looks at right from your scoping to mapping to your artifact collection to when you're testing your models to the reflections that you have from this process, and post audit certain evaluations. So it really takes an entire life cycle approach to auditing, which may be particularly useful in the healthcare field, given that there are so many different points of inflection where checks and balances may need to be placed.
Great, thanks, Amita. That was really insightful. One of the things that I liked about the report was how you lay down the benefits and limitations of both internal and external audits. And as you were just mentioning, it's very useful for people who are developing these systems to consider what audit type suits them. Since we're talking about AI lifecycle, I think an interesting approach that the report takes is to understand the AI lifecycle for a healthcare application by looking at data supply chains and a data supply chain framework. Can you talk to us a bit about that, and how did you come to this framing for the report? And it'd be useful to understand what the data supply chain for AI systems in India's healthcare system looks like.
Thanks, Shashank. Yeah, so I think what we've seen in a lot of AI studies is especially, what we've seen at least in academic research or even more analytical work is that it often tends to take the approach of, design, development, and deployment, which is how you look at an AI life cycle. The reason that we sort of focused on the data life cycle was because we were very curious to understand the data question, to understand what are the sources of data, where is the data coming from when it comes to AI models being developed in the Indian context? How is that data being processed? How is the data learning process happening? And finally, how is that model being deployed in clinical settings? And the reason why we were also interested in this is that there is clearly at this point an information gap on this question of data sources, right? We had our hypothesis initially that some of the data is actually coming from global north context, because there's a lot of open publicly available data that's available on TensorFlow and so on. And so that's a hypothesis that we wanted to also test through this study, which is why we took this sort of data lifecycle approach, and that this approach also lends itself well to the questions of audits, right? Because when we think about data processing, what we did in our during our survey design and through the various interviews that we conducted is that we actually added a lot of options and questions around what would typically be considered an evaluation or a check or a balance that you do as a part of an audit. So within the data processing, for example, we asked several questions around: do you debias your data set? Do you look at imbalance class data sets? Do you look at benchmark data sets, which are also sort of lending themselves well to the audit question? So this is a sort of the combination of our inquiry into really looking at what data is being used and how it's being processed, and to also answer that question of like whether or not AI audits are happening at all, and if they're happening, to what extent, what are the checks and balances that organizations and individuals are applying. So that's really the motivation for us to take this framework. And in terms of the data supply chain, of course, we've pointed to four key steps. One is the data sourcing. So we look at where the data collection is happening, what are the various sources. Of course, we know that the healthcare data field is fairly fragmented if we was to compare it to financial services. Financial services has had a greater history of digitization of its data, more structured data being available, but healthcare data is not the same. So therefore, the fact that there are various fragmented ways in which repositories in which these data is currently sitting, who has access to this data, how is that being used? So those were some questions that we looked at. And the processing stage is where once the training data has been sourced, we look at how is that going through certain preparation on processing stages. So that's really what the data processing stage looks at, and I can tell you a little bit more around the findings as well later. And then the data learning and model development is where, after the collection and processing of raw data has happened, you start the model development process. Within the model development, we looked at slightly more specific questions around, like, okay, who are the actors who are actually involved in this model development process, what are some of the feedback loops and so on. And then finally, when it is deployed, what are some questions of like training and awareness that may be necessary around medical practitioners who are actually at the who are actually deploying these systems in the clinical setting. So that's kind of briefly the sort of approach that we took for the study.
Thanks, Amrita. I think that was some useful context, and I think it sets the tone quite right at this point to dive into some of the depth of the study. And one thing you already point out is that the study looked to explore reliance on global north data sets, which tend to be a concern that arises quite a bit when you're looking at AI systems. Just a quick question on this is what leads to heavy reliance on global north data? You mentioned one is the just general lack of data available in India. Are there other things that contribute to it? And also, can you maybe tell us about other sort of critical takeaways or insights into data practices that have been explored through the study?
Sure. Yeah, so maybe I'll just start with the findings from the study and then kind of go into the why. So in our study, what we found was that there was significant reliance on data sets from the global north. And that's not just across healthcare technology companies as well as medical professionals all told us that there is some reliance on global not data sets, and also that there is almost an equal mix of sort of availability or reliance on open and proprietary data. So there's the hunch was that of course a lot of the open data that is being accessed is global north data, but a lot of the proprietary data in India is also coming from hospitals, from the private players, potentially even the public hospitals. So some of the data is coming through these various sources just to understand where the data is sitting right now, right? I understand more recently that there is actually more availability of data, given that there are various other processes in many recent conversations. There's work that's happening in Ashoka, for example. There's work that's happening in IIT Madras and various medical institutions, which are now also collecting data to develop certain AI models. So they are actually conducting, data collection, building parameters across various parameters, and then trying to see if you actually collect very structured data for the purposes of developing an AI model, how well does that work in in a hospital setting and so on. So I know that there's some of that work happening as well. In terms of like, why is this the case, right? Like, why is it that there's a reliance? I think there is a clear sort of scarcity of good quality Indian data, and this could be one of the reasons for the reliance on international data, which is often readily available in the form of public data sets, which is what we were mentioning earlier, right? Like, for example, models and data sets that are available on TensorFlow. A study of data sets and research in AI in the clinical setting has also revealed that US and China are disproportionately overrepresented, right? Because they are also putting out a lot of data in the public domain. And the problem with that is that if we are training our models on data set that is coming from different populations with different sort of concerns with respect to health, right? And that is being deployed in the Indian setting, that it may actually lead to consequences where the predictions or the detections that are being made are not accurate. And that is one of the major things that came up through this question of data sourcing, that we heard also from interviewees, right, who said that we are actually introducing a lot of bias since we are relying on external data sets. And the fact that there can be different things that are considered normal in different contexts or in different populations. One of our interviewees, who's a doctor, told us that if I'm a pulmonary patient and 90% saturation is normal for me, but if it is considered too high in a different context, you may prepare a model that is already biased. So there are some real challenges if with using data sets that are not local to your context. And this is similar, right, that we heard also for things around imaging, that there could be biases within the training data sets that are being used for imaging that can then have consequences where the predictions or the detections that are being made are not accurate. So the how do you look at abnormalities? What is considered abnormality in something that you're looking at, whether it's an image or whether like what is your cholesterol level, etc. If those thresholds may be different. So those are some real sort of concerns that may arise if you use data that is not Indian in this context, especially so in healthcare.
Thanks, Amrita. I think that some of the findings that you speak to uh, are from the sort of data processing and data sourcing lens, and literature does also indicate that just throughout the rest of the data supply chain, when it comes to engagement among stakeholders, that it becomes challenging, have a sufficient feedback loop amongst stakeholders. So, just more broadly, from the engagement among stakeholders within the sector, can you tell us a little bit about what that looks like through the rest of the model sort of development process, and also how does the feedback loop play into this based off of the study that you've done?
Sure, thanks. Yeah, I think at the point of doing the study, of course, there were certain findings, and after that, we've been part of various conversations that are actually trying to bridge this feedback loop gap. Although I think, of course, they're all happening in silos, and there is obviously a much greater need to have more formal mechanisms of adding feedback and so on. And then we've also done a separate separate piece of work where we actually look at what is the impact on doctors, right? Like if doctors are involved in the feedback process, which they should be if AI models are being deployed, there's also significant burden on doctors. And we know that the Indian healthcare system is already a highly stressed system where the demand for doctors is much higher currently than the supply. So all of these social factors also have an impact on this whole question of collaboration and how well that is happening. So I just wanted to preface this response with that as well, just given that the healthcare system in itself is already experiencing a lot of stress. So in terms of collaboration, one of the things that we found is, of course, a lot of the AI development is happening at technology companies. So the expectation would be that if technology companies are developing AI systems, that they are routinely collaborating with doctors, with stakeholders within the medical fraternity, be it doctors, but not just doctors, but also other nurses, and in fact, if it is public health, then in ASHA workers and various other stakeholders within the medical fraternity. What we found was that only 26% of tech companies actually mentioned that they are collaborating with doctors, right? So and that is telling that if there are models that are being developed that are then expected to be used in medical settings or healthcare settings, that have not been developed with in consultation with stakeholders who are supposed to use it, then that can create problems in both the uptake of those systems as well as training, awareness, knowledge of the people who end up using it. And finally, of course, if there are severe flaws with the model that is being developed or the AI systems that are being developed, that they get unnoticed. So definitely the point of collaboration is really important. And in the context that already the healthcare system has a lot of issues, then one needs to also prioritize what are the kind of use cases in AI that one should be using or deploying, what has higher benefits, almost to do almost a cost benefit analysis to say that these use cases have slightly higher significance, importance, impacts than some others. Unfortunately, a lot of what is happening is that the AI models are also being developed in healthcare in fragmented ways where the funding may be there, or where there may be a disparate interest, as opposed to taking a more sort of systems view to say these are the biggest healthcare related problems where we think AI can help, and then to solve for those problems. Sometimes I think the cycle is being inverted where we're coming up with certain AI solutions and trying to see where they best fit within the healthcare setting.
Thanks, Amrita. That was very useful to hear. I think a very interesting insight from the report for me was also how there was a finding that in certain cases, doctors and medical professionals are also scared that AI will lead to job dilution. And feel free to spend a few seconds talking about that. But just continuing, my next question to you is around how can audits be helpful, right? Especially if we're talking about the data supply chain and over reliance on data sets from the global north. And I think the report also mentions US and China as heavily sort of represented in the data sets that at least you found. So would love to hear your thoughts on that. But what are your findings on how auditing can solve for this problem?
Sure. So I think one is that uh, I won't say that we have found that auditing is already solving for this problem, but I think we postulate that there are some interventions, audit related interventions, that could be useful. So if we perhaps maybe talk a little bit about the data processing part of our findings, where we saw that there are certain disparate steps that organizations are already taking. For example, we asked them various questions around, like, are you making attempts to debias your data sets? Are you using certain data manipulation techniques such as reweighing, resampling, to prevent bias and discrimination? Are you doing things like data cleaning, standardizing data formats? And what we found is that some of these things are already happening in different settings. Perhaps some of these technical steps are happening more in technology companies, but things around following PII related protocols, anonymization is something that is a priority for all stakeholders, for example. And this would be true also for the healthcare sector generally, because they have a history of dealing with fairly confidential information, patient information, and therefore some of those practices are potentially already ingrained within the system. So I think those are useful starting points to think about. Okay, there are certain things that are happening. That could then lend themselves well to an auditing process. When we asked very categorically if people are doing audits, I think what we heard is that we don't really use the word audit, and it's not really a term of art at this point when it comes to healthcare. But people are doing validations, people are doing evaluations, and so on. And there are different processes that different technology companies, different organizations are putting in. We also heard that there were some academics who said that they believe that there should be regular audits, and for things like diagnostic machines and so on, to create benchmarks where we can say that if a doctor's evaluation is a benchmark, how well is your AI system performing against that? Now, of course, one may question whether the doctor's evaluation is the benchmark and so on, but those benchmarks potentially have to be determined and decided. But to use certain benchmarks to say that this is what the AI system should perform against could be useful when thinking about how audits could help. In terms of course, what was our sort of recommendation on audits, we said that perhaps there's some merit in streamlining AI audit as a form of governance, perhaps to standardize this practice, build certain standards through which organizations can say that okay, this is an assessment framework for or an audit framework that we can use in our organization to see how well our AI models are performing across these various standards. The other thing, of course, we said was also to build organizational knowledge and inter-stakeholder collaboration. We already pointed out that there are various issues with collaboration, but can there be certain steps that are taken to have a more continuous feedback loops, and through the AI audit process as well. And of course, the central point of audits is also to prioritize transparency and public accountability, right? Like the traditionally we know that audits have a purpose of creating transparency. So can that be used as some sort of like a principle to then develop either internal or external audit frameworks that create this kind of accountability, public accountability mechanisms?
Great, thanks, Amta. I think we've delved into a fair bit of what, and I'm summarizing a little bit of what we've been talking about, but we've talked about current data and AI practices, just some of the challenges that contextualize why these practices are happening, and of course, how audits can be useful in light of this. Uh, and just to take a sort of broader perspective, could you maybe tell us about what some of these larger changes the healthcare sector may be required to institute in order to improve conditions in which, say, AI systems can be used better, and also to facilitate the use of auditing as a mechanism, or as one of the mechanisms as well, through the use of AI systems.
Yeah, so I think maybe I'll start by just the broader reflection being that this is something that I was mentioning as well earlier as well, is that the approach sometimes now has become very techno solutionist to say that where can we fit AI into this, and we understand that there is a problem of like scale, there is a problem of efficiency, and we are trying to sort of fit different technological solutions to solve for problems of efficiency. And definitely AI can help with that, right? Like AI can help in definitely in internal systems, process efficiencies, operational management, etc. Traditional machine learning can lend itself quite well, and we've seen that across different sectors. For example, if you think about electricity optimization in big factories, AI has helped in doing a lot of those optimization type of work where it is more internal to the organization or to a sector. I think the risk of AI increases when you deploy it in a setting where an end user, where decisions are being made, where predictive models are being deployed to predict certain behaviors or certain outcomes. And in that case, where there are population scale decisions that are being made through the use of AI tools, there's obviously a need for greater sort of checks and balances, greater, sort of guardrails in how those decisions are made. And there are some recommendations that we make towards those as as reflections of broadly how AI, if used in healthcare, what are certain considerations to be made. And of course, given that our focus has been a lot on data, we do talk about adopting more standardized data sharing policies. We know today that a lot of the data is fragmented, is sitting in different spaces. What are the privacy, consent related questions that data sharing practices may raise, and how can and if data sharing is essential to building more accurate AI models, what are certain checks that need to be placed to do those things. And we also talk a little bit about like in terms of what is like thinking about it in terms of as an industrial policy, like as we think about approaches to investing in AI, if financing AI projects, what do you privilege and what do you sort of put in the back burner, right? Like how are those decisions being made, and to really consider what is public good in determining these decisions. So if we are going to use especially AI in public health settings, use AI for making disease detection, where is the need and where is it currently being deployed? One of the things that we were also investigating in our work was that a lot of the currently the price points of AI models or AI systems are fairly high. Obviously, we understand that is because market forces. If it is highly used, then probably the price points will come down. But probably the need at this point for efficiency or for greater use is in public health settings, but a lot of work is also happening in private care and private healthcare, where certain AI systems are being provided as a sort of like a luxury, right? So to also think about what are the where are the real challenges and where are these systems being deployed. And yeah, so and I think the public good or the public value question really needs to be considered when investing and financing AI projects. Some of the things that we also heard from a lot of startups was that the reason why a lot of these checks and balances, audits, or other evaluation frameworks don't exist is because sometimes the funding is just point in time, where you've provided funding at one point, and you have 6 months or 1 year to develop something and build a prototype and so on. And then what happens is that there is very limited time to actually privilege questions of ethics, privilege questions of transparency and so on. So can investors and investing processes actually include some of these frameworks that we do want these systems to be auditable, interpretable, transparent to some extent, and how can those then feed into how startups or technology companies or various developers develop these AI systems?
Thanks, Amrita. Going on to my next question, which is a bit broad, and the lens I'll put to that question is, one of the findings of the report is that India is falling behind health records digitization as one of the factors behind why don't we have high quality data, is because we're not digitizing enough, especially falling behind other comparable nations. And please correct me if my reading is wrong. So my question is, as a reflection, how do you think we can move towards safe and responsible data use in AI systems and adoption of accountability frameworks such as audits in India, right? And I know it's a very big question, and the context is that the government is hearing, I'm sure, and from other research and stakeholders as well, that we need to create high quality data sets, and they're going to do that. What my assumption is that I'm taking on from a lot of what you're saying is that we will somehow deprioritize some of the guardrails we need, especially from a privacy and transparency and accountability perspective. So yeah, some thoughts around that.
Sure. Yeah, and this is where I was also kind of like drawing on like where structured data exists and where it doesn't, right? Like, so, I mean, so some of the things that I mean, this is secondary, this is not some from our report, but like what we found was like even as of January 2022, 60 to 70% of mid-sized and large hospitals in India actually lacked adequate systems for collecting and storing digital health records or maintaining access controls. Similarly, the sources of data that are released by the government are often incomplete due to various reasons, which we go into in our report. But essentially, to say that a lot of the data is fragmented, the Ayushman Bharat Digital Mission has been heralded as a way to digitize and collect health data, but there are reports which suggest that it does. I mean, it still very much requires a lot more work to have standardized data, and there still exist a lot of data quality issues that necessitate stringent data cleaning requirements, which are often burdensome for various stakeholders, including, for example, ASHA workers who also do a lot of this work on ground, right? So clearly, the sector does not have this, and this is, I mean, this is a challenge that has existed in healthcare and is not the same as financial services, which, net banking, if you think about it, right, like net banking started a long time ago, if you think about the Visa, MasterCard. So digitization of records was already happening in the financial sector much earlier, before the conversation around AI even started. So therefore that sector already sort of enjoys a lot of structured data that exists. And of course the data in healthcare is also not interoperable, because there is, it's not standardized. The data, that the way that it's collected and the way that it's being stored is not standardized. And of course, the point that you're making, Shashank, about privacy and security of data, right? Like, so in our study what we found was that there uh, all, like, hospitals and technology companies, and I would also think that, given that privacy has been a conversation in India for a while now, that they are fairly well understood concepts, and people are saying that they are taking steps to maintain data privacy and security. But if we look at the breaches that have happened, if we look at that how some of that data is actually managed on ground, we think that it is probably to actually fulfill compliance and liability requirements, as opposed to sort of really ingraining some of those principles. So in terms of what can be done, I think there's a lot of work that is now happening also with the India AI mission to actually develop data sets that are usable for AI. The big learning from this was that actually a lot of just having data is simply not enough. Like, collecting data or having data is simply not enough to develop AI models, if that's the end goal. Like, it needs to have a certain structure, needs certain parameters, and those kind of things. And how well your AI is able to work with unstructured data, and the amount of work that may be required to process that data can have significant impacts on the quality of the AI model, right? So I think in terms of next steps, I mean, there are efforts to build standardized data sets. That's a recommendation that we as well make. But how do you build standardized data sets that are also secure, that are thinking about, like, patient privacy and consent? And this is a difficult one, because the consent question is something that a lot of discussion right now is happening around. Is it a one time consent? So if I go to the hospital and I consent for my data to be used for the purposes of treating me, but now we are also going to use a lot of the data for developing AI systems. So what is the difference between that, the personal data of then being anonymized and being used for AI? Are there certain consent related questions that it raises? If yes, how do you solve for the problem of consent, because you can't keep going back and seeking consent? So those are really sort of complicated things that need to be sort of discussed and potentially debated. And I think those some of those conversations are happening right now. But yeah, where we go from here, I think is something that one will have to see. The other thing is that, given that some of these things are happening in pockets and in different places, what we also heard, for example, from some startups was, data brokers are right now being used to get access to data, which is anybody's guess on how who these data brokers are, where are they receiving this data from, right? So some of those questions also need to be thought about seriously, to ensure that when we are thinking about developing AI models, that the data is secure, the data, privacy questions are solved for, and that of course that the data is high quality before it goes into developing an AI model.
I think this is very interesting, Amrita, because if I take a step back and look at policy developments in India, and I know your report also covers the Data Protection Act and looking at that as a regulatory point. But I think what currently we're prioritizing is the availability and accessibility to data and data sets. If I look at the Data Protection Act, it prioritizes access to quote unquote publicly available data, and also creates certain exemptions for consent as well. Um, and my reading is that we're treating data to ensure that our startups and the AI community and other sort of businesses have access to data. And then I think what you are saying is simply having access to data is not enough. You need it in a particular structure, you need it in a particular quality, and that's very interesting. I guess my sort of, again, a more macro broad question is, we often hear this um, tussle dichotomy, and there's literature on this as well, about this sort of innovation versus regulation debate, right? And I wanted your opinion on this. You're recommending audit systems as a governance mechanism, and some people will argue that, listen, this is going to hamper development, this is going to hamper innovation. So how do we resolve this? Because even from a policy lens, when we're sitting with policymakers, we're sort of trying to have a dialogue with decision makers. How do we cross over this bridge?
So firstly, this innovation versus regulation, I'm slightly tired of this, because I don't necessarily agree that the role of regulation is to hamper innovation. I mean, the role of regulation, when done right, is to protect users, is to sort of build accountability among corporations, to have rights based approaches to protect users. I mean, that's how I see the role of regulation, is to actually serve the public, and it is not with the intention of either hampering innovation, but it creates certain guardrails in which those the innovation and that sort of work happens. Of course, now there is a lot of conversation globally around regulations, around how and Shashank and CCG has done work around, like, the European regulations, and how they're backfiring, and how the Brussels effect is not really real anymore, and things like that. So there's a lot of those kind of conversations that are happening. But I think India has been, at least through its subcommittee report, it's saying is that right now we don't need to regulate. We have existing sectoral regulations that will work in the governance of AI for different sectors. And therefore, the question to ask is, then what are those regulations? So, and this is some work that we wanted to do at CIS as well, is that to really look at health is, health has various regulations. So can we do initial mapping to look at what are the various state regulations and central regulations that exist, firstly around health, then to look at various use cases and do a very sort of detailed mapping by use case, thinking about how would this particular law apply to this particular use case of AI. So, for example, if you think about the medical devices rules, how would that apply to, let's say, a robosurgeon, right? And what are the sort of questions of liability, accountability that this particular AI system will raise? And I think the point is, right now there is very little awareness about these regulations, if they exist and if they work for AI systems, how that is happening. I think there's very little awareness right now. So I think the first step really is sectorally to think about what are your sectoral regulations that exist. How are they, including the DPDPA, and to think about how are they applicable in your sector, and then go from there to ask the question of whether what are the interventions that are needed. Of course, I don't think I think there's a problem of capacity and resources to be doing this kind of work. And on the other end, we know that globally there is almost like a all countries are trying to move towards sort of greater AI related autonomy. Of course, given the global landscape, that point is well understood. But if this work can happen in parallel, to actually look at how AI is already being regulated, if that is true, and what the gaps are, and then to try and fill those gaps through responses, I think is a reasonable way to go about thinking about regulations.
Thanks, Amrita. I think some of what you talk about also requires us to explore what it means to deal with this tussle. And I ask this because your study engages with a lot of literature. It's done a fair bit of trying to understand questions that haven't been explored too much earlier. And I think just given that you've had to engage with all of this information and with the stakeholders as well, I'm just curious to know if you think that there are currently unexplored questions or just areas that require further research within this area of inquiry, and it'll just be great to get your thoughts on this.
Yeah, I think one of the things that definitely needs research is like evidence of success, right? Like, so I think there is a lot of right now conversation around AI being useful in certain contexts. And some of those contexts are places where AI has already been deployed. Some of them are contexts where AI has not been deployed but is being developed for. So I what I struggle with right now is a lot of, so like I was saying, like traditional machine learning does a good job of optimization, for example. Perhaps the indic language LLMs can do a good job of creating information, and that you're already seeing success in some of those areas. So I think there definitely needs to be more research to build evidence of what works, what doesn't work, what are environments in which certain AI systems will work, right? Like, for example, I think in AI Snake Oil, the authors really talk about like how AI systems may not be very good at predicting social phenomena. It may be good at predicting, like I said, like some sort of optimizations and when certain things will work or not work. But how people are going to react or respond is not very easy, because it requires various parameters to be included in that thinking to be able to predict that. So within the healthcare setting, then, to see like if we are using certain AI systems, what has been the response from let's say medical practitioners who use it, from patients who are being asked to use certain AI systems for some sort of diagnosis or conversations, when your doctor is not actually a doctor but a chatbot, to actually test for those settings and see, is there, because we also have different cultural contexts in India. It's not different people, we have huge amount of diversity, and we cannot have a one size fits all type of approach. And we also know that there's a lot of right now deployment of like LLMs or chatbots amongst ASHA workers. What does it actually do in terms of like burdening ASHA workers? Does it actually help them? What are the challenges that they face if they are expected to use this? So those are questions I think definitely unexplored within the healthcare in India sector, and building a base of evidence to say that these things work, these things don't actually work. For example, we had seen a presentation, we were at IIT Madras, where there was a model that was developed for some sort of neonatal detection. And what was found was that it was, again, data was collected, and it was a very structured data, highly structured data was collected, and a model was developed. But when it was deployed in an environment like a real world environment, the accuracy dropped, because in the real world environment in a hospital setting, there are various other parameters that you may not have considered. So to actually test some of these things, to prototype, and essentially to have more time to do some of this work, I think there's a little bit of anxiety around putting things in the market. And there is also the other side, where a lot of products currently sit in prototypes, and then they sort of never see the light of the day. So how do you balance these, where you are investing in R&D, where you are building evidence to see what works, what doesn't work, and then have more thoughtful responses to how you deploy AI in healthcare, perhaps.
Great, thank you so much, Amrita. I think this has been a really useful conversation. The evidence of success and just informing iterative approaches to informing the development of AI systems is something that we've also been thinking about, and I think it's really good to hear that from you as well. I think we can wrap up this episode, and thank you so much for taking the time to speak with us. It's been a really good conversation.
Thank you so much. I really
Same here, Amta. Thanks so much for your work. And it's been delightful reading the study. And we hope others are listening and they can build from your findings as well.
We would love to hear your thoughts on the episode and your suggestions on what topics you would like us to cover. You can reach out to us through email or find us on our social media. We will link the details of these in the show notes. Lastly, we would like to thank National Law University Delhi for their support in creating the podcast. If you enjoyed the conversation, please like and subscribe wherever you're listening to the podcast. We look forward to bringing you more content. This podcast is created by Center for Communication Governance at National Law University Delhi. This episode was edited by Gopika.